Hello everyone. Let's discuss very important complaint of patient, that is low back pain. From global burden to patient recovery. A comprehensive guide to understanding, diagnosis and managing one of the medicine's most common challenges, that is low back pain. As a human being, we walk on two legs. So the body weight transmitted through spine, through vertebra, because of the gravity. So you can say it is a low back pain is a unavoidable side effect of human being, as human being walk on feet, on two legs. The hidden pandemic, 84% lifetime prevalence. Most people will experience low back pain at some point in their lives. Number one global disabilities, leading cause of work dissenteeism, absenteeism, and years lived with disability worldwide. The anatomy of the foundation, the key structural elements: 33 vertebra, stalks with a shock absorbing intervertebral disc. These vertebra stalk one above another, and intervertebral disc in between them. 3 joint complex, disc plus 2 facet joints working in concert to enable movement like flexion, extension, rotation. Transitional vertebra found in 3 to 35% of population, a clinically significant variations. The clinical clockwork, understanding the intricate network that orchestrate body functions and often become the source of low back pain. Spinal cord, central conduit of the nervous system, transmitting vital information between the brain and the rest of the body. Spinal nerve, 31 pairs emerge from spinal cord, serving as crucial communication lines to specific regions, enabling sensation and movement. Dorsal and ventral roots, sensory information enters the cord via dorsal root, while motor commands exit through ventral roots to activate muscles. Segmental innervation, each spinal nerve pairs corresponds to specific dermatomes, skin sensation, and myotomes, muscle function, creating a predictable map of nervous system to control the body function, body movement. The clinical clockwork, understanding the natural history of low back pain is essential for realistic patient expectations. Phase 1, 50% improve within 1 to 2 weeks. Phase 3, 90%. Phase 2, 90% settle with conservative care, 6 to 12 weeks management. Phase 3, patient may need 5% may need surgical intervention because of neurological deficit, decreased sensation, weakness, bladder wall, sexual dysfunction. The 5% patient may need surgical intervention in phase 3. Detecting the danger zones, age alert. New onset pain in patient under 15 or over 50 warrants urgent investigation. Systemic signs, night pain, unexplained weight loss or persistent fever, suspect malignancy or infection like spinal tuberculosis. Neurological deficit, bladder, bowel or sexual dysfunction, possible cauda equina syndrome requiring emergency care. The diagnostic art beyond imaging. Most back pain is non-specific. Imaging rarely changes the management. History taking, mechanical triggers, psychosocial factors, and onset and duration. Proper history taking is very important to understand the disease progression and management plan for better outcome in low back pain. Physical examination, gait analysis, range of motion, neurological testing, and other special tests must be done for better evaluation patient with low back pain. Imaging is often not required for non-specific low back pain. Clinical history and physical exam guide the most decisions. Routine MRI is non-specific low back pain, can lead to overdiagnosis and unnecessary intervention. The green light strategy: stay active, prioritize movement over bed rest. Movement increase your muscle strength. Movement flex the joints, so they improve the rigidity and also pain. Because if the muscle strength movement exercise increase the muscle strength, the body weight most of taken by the muscles, not by the spinal bones. Activity prevents chronicity and deconditioning. Reassure and explain. Patient education is among the most effective initial treatment available. It is always for better outcome in patient with low back pain. Patient education and explain what to do, what not to do is very important. Judicious analgesia. NSAID and analgesic used selectively, not as first resort, but to support function. When treatment shifts, for patient not improving, a broader biopsychosocial approach become essential. The psychosocial barriers that hamper the better outcome is fear avoidance behavior, anxiety and catastrophism, work dissatisfaction and depression. So psychosocial barrier must be managed properly for better outcome. Therapeutic pillars: physical therapy, functional restoration and graded exercise is very crucial. Occupational therapy, return to work planning, how to return the work again is very important. Is a part of planning for better management. Chronic pain, multimodal long-term management strategies in case of patient have chronic low back pain. Prevention and lifestyle, ergonomic foundations, proper chair selection, workstation height, posture habit, reduce recurrence risk. So where you are your workstation, where you are working, your chair, table, the posture, how you sitting or working position is very important to prevent chronicity of the and recurrence risk. Core strength, targeted strengthening of paraspinal and abdominal muscle improved, provides lasting spinal support. So if you I repeat that if you have good muscle strength, strong muscle, the body weight, all the workload is over the muscle, so not on the bone of the spine or not on the vertebra. If the muscle is weak, or so most of the body weight and workload goes to the vertebral, that spinal cord, to the spine, and there is a chance of increased chronicity or recurrence risk. So it's very important for targeted strengthening of the paraspinal and abdominal muscle by exercise and increased physical activity. Movement as medicine, weight management and regular low impact activity are the cornerstone of long term spinal health. The path forward: 90% recover, education and conservative care resolve the vast majority of the cases. Partner with patient. The provider's role: guide, reassure, and restore the quality of life as a doctor, as a physician, if you encounter a patient with low back pain. Stay active, move forward. Activity, education, and engagement are the best long term medicine for better outcome, reduce chronicity, recurrence rate in case of low back pain. Thank you.